Hello, and thank you for joining this live toll-free telephone town hall meeting with Congressman Randy Weber. Tonight, you'll have the opportunity to hear from Congressman Weber and other government officials regarding the latest updates on the coronavirus response. On the line, we have representatives from the Small Business Administration, the Texas Department of State Health Services, the Galveston and Jefferson County Health Departments, and the Texas Department of Emergency Management. They're ready to answer your questions. Before we begin, a few quick reminders. If you have a question and you'd like to ask Congressman Weber or any one of our guests a question, you can do so by pressing *3 on your telephone keypad. Again, you press *3 and you'll be placed into a queue where you'll have an opportunity to ask a question of one of our guests. We'll try to get to as many questions as we can, and we're going to try to get, and again, you can press that *3 at any time to get into the queue to ask your question. With that, please welcome your Congressman, Randy Weber. Congressman?
Well, thank you, Jason and friends, and thank you to all that are joining on this call tonight. And I do want to echo what Jason just said as a reminder, if you have a question for me and for our experts, please press *3 to be entered into the queue. Folks, I'd like to take this time to encourage you also to subscribe to my e-newsletter at weber.house.gov for the latest updates on the coronavirus response, and up-to-date resources are available for your use. Let me just say, friends, that these are absolutely unprecedented times. What began as a public health crisis now has developed into a full-blown economic disaster, with confirmed cases of coronavirus across America and here in our community, even now, still on the rise. It's stifling economic activity. Countless American workers are being furloughed or being laid off. I don't have to tell you all that large and small businesses alike are in danger of closing their doors permanently. I mean, the short thing is Americans are suffering. As your representative in Congress, my goal is to provide you with every possible resource available and to bring you as much information on the ongoing response to this national crisis. Please be advised that all of your offices, all 4 of them, Washington, D.C., League City, Beaumont, Lake Jackson, they are all open for business. Now, it is a fact our staff is for the most part working from home with some limited time in the actual offices themselves, but we are continuing to do your business, continuing to look out for you, and continuing to work as hard as we can to get back on top of this crisis, which we will. We will. So I want you all to please be encouraged. A little update. Last week, Congress passed the Coronavirus Aid, Relief, and Economic Security CARES Act. And just so you know, the legislation provides the necessary relief to assist families and to bolster the economy. This bill offers direct assistance to families, to small businesses, and workers through recovery checks. Additionally, this legislation includes $350 billion with a B dollar in federally guaranteed loans through the Paycheck Protection Program for those small businesses, allowing 8 weeks of cash flow assistance to maintain their payrolls. It grants the Treasury Department and the Federal Reserve the flexibility to provide support to industries that are in reality harmed by the government mandate. Additionally, the bill rushes much-needed resources to our frontline hospitals, our tireless health professionals, and our first responders, while also expanding the use of telehealth. As this legislation is rolled out, there are many of you I know that will have questions related to this bill, resources that are newly made available to you, response efforts underway, and what does that mean for us as Texans? As Jason mentioned, tonight's town hall is intended to bring some of our great government officials directly to you to answer any questions you have regarding the COVID-19 response efforts. As Jason said, on the line tonight, we have those officials, and I want to take a minute. We have 2 local health officials. We have Dr. Walks of Jefferson County, Dr. Kaiser of Galveston County. We have Sushil Kumar, Public Information Officer for the USSBA, Officer of Disaster Assistance. We have Commissioner Dave Gruber, who's Commissioner for Regional and Local Health Operations for the Texas Department of State Health Services, as well as Assistant Chief Sean Miller from the Texas Department of Emergency Management. And we were going to have, by the way, Chief Blair Walsh, and she came down feeling under the weather, so she couldn't be with us, and we appreciate her being willing to. We want to thank them all for all that they're doing to get you the resources you need and to defeat this virus. To ensure that y'all all have the ample opportunity to have your questions answered, I want each one of those officials to take a moment to introduce themselves, 30 seconds to be exact, and describe their role in the response efforts. I will then immediately open up the lines for questions. Before I do that, I will remind you that if you're not able to ask a question or share your comment tonight, please feel free to visit our website, your website, weber.house.gov, and sign up for my e-newsletter for up-to-date information on the COVID-19 response. And you can also find me on Facebook and Twitter by searching TXRandy14. Again, the lines are open. When you want to ask a question, hit #3 on your telephone keypad to be placed in the queue. But right now, I do want to hear from our guests who have agreed to help us. So, Dr. Walks, if I can begin with you, take about 30 seconds and tell us where you work and about your position. Doctor? Do we have Dr. Walks on the line, Jason?
Oh, he must have dropped off.
Okay.
I'm Dr. Walks. Working with Jefferson County. We have a department, and we have a consortium of 6 counties, and we have a call center in which all the calls go to, and we test and triage all the people that call into our call center.
Well, thank you for being here. Dr. Kaiser, how about you?
Yeah, hi, this is Philip Kaiser. I'm the local health authority for Galveston County. I'm also a professor of infectious diseases at University of Texas Medical Branch. My role has been to help the county in terms of preparing for the public health response, and we've also been working with the local hospitals in the county, both UTMB and HCA, to help coordinate their standing up a response to the COVID crisis.
Thank you, Doctor. Mr. Kumar, are you still with us? Have we got Mr. Kumar on the line, Jason?
I believe so. He may be on mute.
Let's
Okay,
jump.
I am Congressman, and I was on mute, and I couldn't get to it fast enough. I apologize, sir.
Well, tell us about your position.
A public information officer for the United States Small Business Administration, wanting to share details about our economic injury disaster loan so that businesses can take the time to apply with us for our long-term plan, and any other questions that the audience might have.
Well, thank you for being with us. I've had a lot of inquiries into the SBA and the loan program and all that means. Commissioner Gruber, are you with us?
Yes, I am, Congressman. Good evening to you and everyone on the line. My name is David Gruber, and I'm Associate Commissioner for Regional and Local Health Operations at the Texas Department of State Health Services. My role is to work with our public health and medical counterparts throughout the state and with a bunch of us at the Department of State Health Services to work emergency preparedness and response operations that ensure that our hospital system remains intact and that we keep our public safe.
Well, thank you for that. And how about Assistant Chief Sean Miller?
Thank you, sir, for this distinct opportunity. And again, my name is Sean Miller. I'm the Assistant Chief for the Texas Division of Emergency Management. And TDEM is responsible for implementing a comprehensive all hazards emergency management approach within the state. But it really starts at the city and the county level. And that's what we do. We help the cities and the counties ensure that they have that all hazards approach to emergency management. Now, during this disaster, the state has been working hand in hand with local governments, as we have consistently done in countless other disasters. Although this pandemic is unlike any disaster we have faced in generations, the all hazards approach in emergency management that the city, the county, and the state level practices every day, that it's planned, organized, equipped, and trained, we're able to combat this disaster and any future disasters that we may see. Thank you again, sir, for this opportunity.
Well, thank you, Chief Miller, for being with us. And Jason, with that, I'll kick it back to you.
Thank you, Congressman, and thank you all for joining us. Again, this is a live toll-free telephone town hall hosted by Congressman Randy Weber. Some of you had jumped on the line a little late, so I did want to give you an update. If you'd like to ask a question at any time, you can press *3 on your telephone keypad. Again, *3, and you'll be placed into a queue to ask a question. We're going to take callers in just a minute. One request we have is when you do ask your question, if you please will, because we have so many folks asking questions, we want to make sure we get to as many as we can. We're going to have you ask a question, and then we're going to have our Congressman Weber and our guests answer that question and then move on to the next one. So if you have a two-part question, if you could just tell us right away if you have two questions, what they are, so we can get through them and move through the line as fast as possible. So with that, again, if you have a question, please press *3 on your telephone keypad if you'd like to ask a question, and I'll be saying that quite a bit throughout the course of this telephone town hall. Our first question, or our first person asking a question, is David Westmoreland from Dickinson. I'm going to bring David live. David, are you on?
Yeah, I'm on. I did get a question, Congressman. I've been looking at your website about I guess this is a two-part question. You've got a lot of good information on the SBA loans and and since I'm a small business person, I'm on business. It is an LLC, but I'm the only person that is actually in it. Does the SBA consider that to be a sole proprietorship, or is it still considered an LLC for the process that starts in the morning?
Well, thank you for that question, David. And Michelle, I take it you're still on the line. My understanding as a former business owner, I had an LLC, that they're going to allow people who own their own business, sole proprietors, to actually qualify for some of the same funds as if they worked for something. That's what's being hammered out. Are you familiar with that, Sushil Kumar?
I am, sir. Here's the rest of the equation. The gentleman can go right to our website right now, COVID-19 relief.sba.gov, hit the radio button, which is number 2 under sole proprietorship, answer the same questions, pretty straightforward, business name, LLC, whatever it might be that he has specific to his situation. And at the end, before he submits, he'll be asked if he wants an advance against his potential loan. And then, if he accepts it, the money will be in his account between 3 to 5 business days. What you're referring to for tomorrow is the PPP, where sole proprietors are also eligible, but that is much more defined in its time frame. It needs you to describe an 8-week time frame, going back to February 15th, and identify that period of time where you want your injury to be met. So the business owner needs to figure out which one is more conducive, because one is stimulus related, the other one is working capital inclusive, if you will. So I'll leave it up to the business owner to ascertain which one works for him or her better.
Well, thank you for that, Mr. Kumar. Thank you, David, for that question. Jason, who's next?
We appreciate that question. Again, if you have a question that you'd like to ask Congressman Weber or any of our guests, please press *3 on your telephone keypad. We're going to go to Edward in Friendswood, Texas now. Edward, are you on the line?
Yes, I am.
Go ahead, sir.
Yes. First of all, I'd like to thank everyone for this. I was surprised and pleasantly, and I'm very appreciative of everyone being there. Second, I have 2 questions. First, my son hasn't filed taxes in the last 2 years. He's had trouble finding work, and he's just been down on his luck. And I understand he's eligible for the $1,200, and I don't know how to advise him to apply for that money. That's my first question. And the second one is I lost my driver's license. I cannot find it, and I'm worried about identity theft, and I can't reach the DPS because no one answers the phone, and I can't navigate through the website to find how I can get a replacement license and or a new number because I'm concerned about identity theft. Those are my questions. Thank you so much.
Well, let me back into that if I can. Is your last name Perotti? I guess I'm saying
Yes.
it right. Well, good. I live in Friendswood too. And so we're glad to hear from a fellow Friendswoodian, and appreciate your comments about you appreciate us doing this.
Yes.
Maybe we'll back into this with Assistant Chief Mr. Miller, Chief Miller. I don't know if you've had experience with this, Chief Miller, being Texas Department of Emergency Management. What happens when someone's in an emergency and they lose their driver's license? Any answer for our friend?
At this time, I'll have to get with the Department of Public Safety and reach out to them, and then we'll get their answer and provide that back to you, sir.
Right. Well, there's got to be obviously there's going to be more people that are in that same predicament. Now, on the first one, where your son has not been employed basically for the last 2 years, I think I'll send that over to Mr. Kumar if I can. And what does that sound like to you, Mr. Kumar, the tack that path he needs to take?
From a standpoint of looking for gainful employment, that would not be my area of expertise. My understanding on the stimulus payments is that the Treasury would be looking at the most recent direct deposit information that they may have on the individuals that have filed. That is my understanding.
Right.
If I understood the question correctly.
Well, I think you did. Thank you for that. That was what I was thinking too, that they would go back and look at the last tax return. So I appreciate your help there. Jason, who's next?
Sure.
Okay, great. Once again, just a quick reminder, if you have a question for Congressman Weber or any of our guests, you can press *3 on your telephone keypad, and you'll be placed into the queue. Our next caller is Brian Friedman, also from Friendswood. Brian, go ahead. You're on the line.
Hey, Congressman, good evening. Huge thanks for doing this and for all your leadership on the stimulus package and for all that you do for everybody in the space business in the region. My question is more about how you and some of the medical experts on the line see this playing out. How long, if you're looking into your crystal ball, are we on lockdown and have these shelter in places? And then once we get through this portion of it, how do you foresee kind of the economy and everybody starting to come back online? How do you sort of predict that's going to unfold? Can you just talk about the future a little bit and what we should be preparing for and then what we should be getting ready for as things start coming back online at some point in the future? Thank you.
Well, sure. Thank you, Brian. I appreciate that. We'll back into it in a bit of a different way. I have to tell you, even though we've not been able to be in our offices per se for almost 2 weeks now, we have been on phone calls, conference calls. I think I've been on an average 3 or 4 conference calls a day. Whether they were, and we watched, of course, via television, the White House's conference with President Trump. We've been on conference calls with the SBA. We've been on conference calls with Dr. Fauci. Been on conference calls. I mean, you just name it. We're kind of predicting. I'm hearing a lot of different talk about them predicting that it may peak it may take as long as up to 4 weeks, and we'll certainly get Dr. Walks and Dr. Kaiser away in just a minute. They're watching everything that's going on. I've got the latest update from the Texas, for the state of Texas. The last one we looked at this afternoon, it looks like we've got 44,669 positive cases and 70 deaths. Now, that's state specific. I'm obviously concerned about the state of Texas. I'm concerned about the whole country, but we're focused on Texas. So how long does that peak take? How long before people will be allowed to come back in? As you're probably aware, Brian, there's been a lot of the governors across the country closed down schools, varying times, some the end of April, sometime in May. And we've heard talk about some saying that they're done for this year, basically, and starting in the fall semester will be next. Our great teachers, our great educators, of which my wife was one, she's a retired educator, 27 years she taught fourth grade, are working fast and furiously, working with these kids and doing everything they can to maintain our education. So some of that will depend on exactly how long before it peaks. And before I go to the business part of it, Dr. Walks, what are your thoughts about the virus peaking?
Well, they say the virus peak is going to be May 9th in Texas, and it may be that or maybe a little longer. But I don't think that we're going to be done for the foreseeable future. I think it will be sometime in June, late June or so, before we see a leveling off of the curve.
Right. Dr. Kaiser, your thoughts?
I agree. It's going to be a while. We've been looking at what's been happening in New York City and in New Orleans, and also what's been happening in other countries. And I think there are a lot of models out there. They disagree in terms of the magnitude of the numbers of cases. All of them are going to be high. But I think that everybody agrees that in Texas, at least particularly in our region and southeast Texas, we're looking at something peaking around the first or second week of May. Now, I think it's important that people understand peak doesn't mean over. Peak means when the cases stop growing. And then we'll have to keep a close eye on how things are going in terms of how rapidly they fall off. One of the things that we're going to be looking very keenly at is the places that have been hit hard before us, such as New York and New Orleans, and see what happens when they peak and what happens when they start relieving controls. And so, because we are behind them, we're blessed in a little bit in that we can learn from the mistakes that they've made and not either let up too soon or let up too late. And I realize this is going to be a very, very tricky issue and tricky question for a lot of folks, and it's something that we're certainly in consultation with, even in putting these things into place, with our political leadership and with our our business leaders, and we realize it's difficult. It's difficult for all of us, but I think it's going to be a long haul.
Well, thank you for that, Dr. Kaiser. And Brian, I would say that being a native Texanian, if you're a native Texan, growing up on the Gulf Coast in a 20-mile radius, I learned to ski in Galveston off its bow when I was 16, and over in Liverpool, Chocolate Bayou when I was 16. I've watched this whole area grow, and I remember the different hurricanes. Texas is a blessed state. Texas, in my opinion, not just my opinion, is the economic powerhouse of the country, especially when it comes to energy and chemicals. And NASA, our great Johnson Space Center, is in our area. And so I have to believe, having watched hurricanes come through here, my first hurricane was Hurricane Carla in 1961, Alicia in 83 or 84, whatever it was, and I've been through a bunch of them. Rita, Katrina, I think Katrina was one that hit New Orleans so bad, and of course Hurricane Ike, and then Hurricane Harvey, and then the rain after that. We respond quickly. So when Texans are down and Texans are hurt, I have to give it to our citizens in our state. Boy, they get back in gear in a great way. And I have to give it to our great businesses and our great medical teams, too. You probably know UTMB is the third leading infectious disease facility in the country. And I heard a great testimony about it the other day I won't go into now. But I have to believe, I watched Texas rebound from Ike. I watched a lot of the businesses keep their people on. Their people went out during Harvey and they mucked out houses, and they did things that we didn't think could be done. They rolled up their sleeves and they went to work. So I can't give you an exact time frame, obviously. And I know Congress is watching this carefully, and we'll be working hard and diligently to make sure that we get it back as quickly as we can. And I have faith, and I'm optimistic about Texas that we will come out of it. We like to say hurricane in the crash of 2008, the picture of Hurricane Ike, in the economy crash. Texas was the last one in and the first one out. And so I have to believe we'll be similarly positioned to do it this time. So keep your fingers crossed. We're working. Thank you for that question. Jason?
Yeah, we appreciate that question. And one last time, I do want to just remind folks, if you do have a question, we are dialing some more folks that you can press *3 on your telephone keypad if you have a question. Our next caller is Jeffrey from Nederland. Jeffrey, go ahead.
Yes, sir, I'm here. Again, I want to thank you guys for doing this for public awareness in these trying times. I'm a small business owner, and I'm wondering, in layman's terms, can you guys explain to the small business owners that are impacted so hardly by this, how do we go about getting some of this funding? Is there a website, or how do we go about getting assistance?
Well, thank you for that, Jeffrey. That's a great question. And before I start to get that answer for you, just for your information, my beautiful bride of almost 44 years, will be 44 years in November, grew up over in Nederland. And
awesome.
She graduated from Nederland High. I tell people that, and they say, she's a bulldog. And I say, yeah,
she's a bulldog.
Yeah. But I think the answer, we've had this question multiple times, and Mr. Kumar, if you're still on the phone, you had exact directions about how to get to that website. If you could explain that for Jeffrey over Nederland, I'd appreciate it.
I'd be glad to, sir. Hey, Jeffrey, I'm from California, but I've spent so much time in Beaumont that I consider myself a resident of Beaumont, and Nederland's one of my favorite places to go, and I have lots of friends there, and so I know exactly where you are in terms of your geographic location. First and foremost, very simply put, let me give you the website where you can access the portal for resources. The Economic Injury Disaster Loan website is covid19relief.sba.gov. When you punch that into your computer, up comes a website. Based on your entity formation, you have 8 different choices to pick from. Whether you're a business with under 500 employees or more than 500 employees, if you're a nonprofit, if you're a tribal concern, so on and so forth. Certify that you're not involved in any type of activities that preclude you from receiving the assistance that you need. After that, it's pretty much answering questions about your revenue, your cost of goods sold, your ownership structure, and then answering whether or not you want the advance against your possible loan in the amount of up to $10,000, and those funds will be made available to you within 3 to 5 business days after you apply. And if for some reason you're not approved, you don't have to pay that grant, advance in this case, it becomes a grant, and it's up to $10,000. So if you have 5 people, it's $1,000 per employee, so you get a maximum of $5,000. What is a working capital loan? It basically means that bills that you're able to pay prior to the disaster, in this case COVID-19, you're able to pay out of your cash flow. Now, unfortunately, you're not able to pay. And in finance terms, it basically is the difference between what you have on your left side of the ledger, assets, current assets, minus current liabilities, which is on the right side of the ledger. There's a number that comes out. And that number is what you need to have handy to keep your operations solvent. It is a measurement of solvency of your business. I hope that helped.
That is very helpful. Thank you, Mr. Kumar, for your answer on that. One other thing I did want to mention, Congressman Weber, is that if folks want additional resources, that they can go to your website. And for those that might have missed that, it's www.weber, weber.house.gov, weber.house.gov, for some helpful information and an opportunity to subscribe to the Congressman's e-newsletter. So I know some folks have been asking for different pieces of information and did want to make sure that we had mentioned that again. So with that, we're going to go ahead to our next caller, which is Sylvia Johnson. I didn't catch where Sylvia was from, but Sylvia, are you on the line?
Yes.
Go ahead.
Yes. I was calling to ask, since there's no actual vaccine for the coronavirus, I'm trying to understand what is it, the treatment that the people are being treated with, and then they're being sent home. So how do we know that when they're being sent home that they're not going to get sick with the virus again and be able to spread it if there's no actual vaccine? The vaccine they're saying takes a year or more to be able to come up with a vaccine. So how are these people being sent home to go back out into communities or whatever? How are they being sent back home?
Well, thank you for that, Ms. Johnson. I'm going to assume you live in the Beaumont area with the 409 area code. And
yes, I do.
Well, good. As I said earlier, my bride grew up over Needleton, so I'm gonna get here to Dr. Walks in just a minute, but I want to give you a little bit of comfort. About 2 weeks ago, Congress had the vice president came in with the group that the Texan appointed to be on top of this, and we had 5 research scientists. I mean, these are folks from the top biological lab, the top medicine people. It was Johnson & Johnson, it was Merck Industries, it was CDC, it was, oh gosh, who else was it? Dr. Fauci was there. And some of these doctors were the research scientists, were the companies that developed the vaccine some time back for the AIDS, so that it wasn't necessarily a death sentence. You could at least maintain that against the HIV virus. There was a doctor there who had helped develop the vaccine for Ebola, and these was just some really brilliant minds, and they are working fast and furiously around the clock. They told us how many scientists were doing research. It's mind-boggling, and that they would work with the FDA, that the president would instruct the FDA to fast-track as much as they could, be safe for humans, but get to this bottom line very, very quickly, so that we can have a vaccine. And I know there's a couple of drugs out there that they've been testing. There's been some anecdotal evidence on them that they are doing a good job. So I just want you, Ms. Johnson, to take heart in the fact that you've got the brightest, the finest, the best in the country working around the clock to get this done in absolute record time. And with that, I'm going to ask Dr. Walks to address your question about once somebody is treated, how do you know what to expect? Dr. Walks, are you on the line?
Yes, Ms. Johnson, when this virus attacks you, your body produces antibodies against it. And if you survive the time in hospital, you have antibodies against this virus, which prevents you for some time getting the disease again. We are not sure how long your antibodies last and give you that immunity, but it should be some time, maybe for the rest of this year and possibly into the next year. And also the fact is that we know that some people spread the virus a little after they've gotten over the disease, but that is not very long after. So you can't be spreading the disease, and you can't be reinfected again.
All right, thank you for that, Doctor. Jason, back to you.
Yeah, thank you for that question. We now have our next caller, who is Donald McGraw from League City. Donald, you on?
Yes.
Go ahead, sir. Donald, we're getting some bad feedback from you.
Can you move around a bit here?
There you go. Much better.
You better.
Yes, sir.
Yeah, I'm retired. I've been at work for a couple months due to my health. I'm fully licensed. I'd like to know how I can help, like telemedicine. I'm perfectly capable of doing that. And I've tried through the online headhunter thing and had the result. But there's somebody else that put me in contact about that. More than fun to do it.
I think I understood your question. It sounds like Dr. McGraw, that you are a licensed doctor, but you're no longer practicing, and you're offering your services, if you will, and you can do telemedicine, which when I was in the Texas legislature, we expanded telemedicine. I think Texas is one of the cutting-edge states in that field. I would suspect, and since you live in League City and Dr. Kaiser can maybe weigh in here, I would suspect, Dr. McGraw, that you would have to reach out to a facility in Galveston County and maybe offer your services. Dr. Kaiser, what would you think about that?
Yeah, I think any place that you could reach out to would be very welcoming. Within the health department, we have something known as the Medical Reserve Corps, and this is for healthcare professionals who are willing to volunteer in a time of emergency and crisis, for hurricanes, if a plant blows up or something where we need people. And you can do that through the health department. And I would encourage you to go to the website, and you'll see a call number, and call in there, and they can hook you up so you can sign in up for the Medical Reserve Corps. We're having discussions on how to activate that as we speak right now, and we'll probably be needing people within the next several weeks.
Thank you.
Hey, sir, this is Sean Miller with the TDM. Also, if the doctor would go to texas.gov, you can just type that in your web browser URL. It'll immediately take you to the state of Texas official website for COVID-19. In fact, when you go onto that website, there's a red banner on the top of it where it says, for more information about COVID or coronavirus 2019, please click here. It'll hyperlink you to a location that has a whole bunch of helpful information. And if you just slightly scroll down a little bit, it says Texas needs volunteers, and it actually says if you're an active or retired healthcare provider, please register here to volunteer, and then it'll get you into the queue. And we truly appreciate your support.
Oh, thank you for that, Mr. Miller. Appreciate that. Thank you both, doctors. Jason, back to you.
Okay, just one last reminder I did want to make for everyone now that I believe we've called out to everyone in the district. If you have a question and you'd like to ask it, you can press *3 on your telephone. Again, *3, and you'll be placed in a queue to ask a question. Our next caller is Dina Driscoll, and I didn't catch where Dina was from, but go ahead. You're on the line.
Hi, yes. First, I want to thank you, Congressman Weber, for putting this together. It's been very informative. And I also want to thank Dr. Kaiser for the great work he's done for Galveston County. My question is, do you foresee them opening up testing to just anyone who wants to get the test for the virus? And if so, when do you think that might take place?
Well, thank you for that question, Dina. You sound like you're from Galveston County.
I am.
I would say that, the test kits are limited. They want to make sure, as I've been watching this, I don't know if you heard my comments earlier, but gosh, I have been on conference call after conference call after conference call over the last week and a half, or almost a week and a half now. And the faster they can produce them, and you're seeing that getting ramped up, you're seeing the President Institute earlier law that says they can manufacture these things. The more they'll be available. Now, having said that, there are screening areas in almost every area because they don't just want everybody to come in and say, hey, look, I think I might have touched that virus. I was in a plane with somebody that did, and that they're not showing symptoms. they're going to screen those. The actual numbers, just if you'll be encouraged, they're ramping those up as fast as they can. I can't tell you how many calls my office has gotten. And to the gentleman, if he's still on about who lost his driver's license, if he would check with us, reach out to our office, we can help him there. Yeah, put him in touch with the right people. But back to you, Miss Dina. They're going to be producing those as quickly as they can, screening as fast as they can, keeping those records. And we have to remember that when somebody gets the virus, I think one of the doctors talked about earlier, that you do build up antibodies, but does that mean you won't get it later? I don't know. Does it mean you absolutely can't? I don't know. So they want to be sure they use those test kits from everything I've seen, heard, and read. I've done a little research myself on those who have the symptoms, on those who are likely to have the virus, make sure that they don't just use them on somebody who, thinks they might have it and they just really want to know for their own peace of mind. Now, how quickly that'll be ready, I don't know. And what was your second part of your question? Did we lose her? Dr. Kaiser, you want to weigh in on that? What do you think about the test kits?
Yes, actually, we're seeing an increase in the number of test kits. We've been using UTMB as our main testing site. We are currently in discussions with UTMB about setting up some public sites for testing as early as next week. I'm always a little reluctant to say things like that because, it's so easy to overpromise in this, but I think we're almost there. And we're also seeing that as the test kits become available, we're relaxing some of the symptom criteria so that we can broaden out the number of people when we start testing. And so if we actually start testing in the general community within the next week or so, we're going to have a more relaxed criteria. Instead of saying you have to have fever and cough, we'll probably say fever or cough. As the tests become available, we'd really like to be at a point where we can just say anybody who wants a test can get one. We're not there yet, but UTMB has more than doubled its capacity to do testing in the past 2 weeks, and they're really helping us out and pushing this out to the public.
Well, that's great to know. And I do want to say, if Ms. Dean is still on the phone, of course, this is over in Jefferson County. We got some insight from Jefferson County that they had put together some drive-through areas. And I know I was on a conference call with City of Houston Mayor Sylvester Turner, and they had some. And so they're getting more testing facilities out there, but it's just taking time. Dr. Walk, are you aware of
Yes,
that?
we also have a complete mobile unit, and
right.
we are going to the outer areas, the small towns like Nome and Cheeks and China and Bevel Oaks, and we're testing people in those areas as well.
Right. Well, that's good to know. So, Ms. Driscoll, if you could be, encouraged, because as these are taking effect, these kinds of things where people are having drive-around facilities, where people are having drive-through facilities, they're sharing that experience and that success with other providers, and it's getting better. I know it's not as fast as any of us would like to see all the tests kits spread out and get this thing kicked to the curb, if you will. But be encouraged. We are making progress. So thank you for that question, Jason.
Okay, we're going to move along as quickly as we can so we can get to as many of these as possible. Our next caller is Mark Abernathy. Mark, are you on the line?
Yes.
Go ahead, sir.
Yes. Yeah, I was been trying the last couple of days trying to contact. I know we need a lot of ventilators. I've got a company, and these are all certified, and they're already in use in the hospitals. But we've got a company that'll provide us with 1,000 per day, 30,000 a month of ventilators, used for the hospitals and also residential use also, and many, many masks. I'm trying to find the best way to locate. I know New York needs about 40,000 ventilators, Kumo says. California, I'm sure Houston's going to need it pretty soon, Louisiana. How's the best way to get the information to them that we have all these ventilators?
Let me jump over, if I may, to Assistant Chief Miller on this one. Are you with us, Chief?
I am, sir, and I'm happy to hear that question. So, Texas.gov is our main one-stop shop for not only registering to volunteer, donating equipment to help Texans, as well as selling any type of service or equipment to Texas. So if you go to Texas.gov, click on the top of that webpage. It's for more information. Click here for Coronavirus 2019, and it'll take you. If you just then scroll just a little bit, you'll see in red lettering, Texas needs supplies, services, and equipment. And you'll see in white, it'll say selling to Texas. So if you just click on that, it'll bring up a registration form, and then we'll get your information, and then we'll be able to contact you directly for that important equipment, important supplies. Thank you, though. Thank you for supporting us.
Yeah, that would be great. Also, I wanted to add, I go to China quite a bit. I've been there probably 40 different cities. I've seen the virus grow in China and what they did to stop it. I've got many friends there. They show me when they're going to the store. They actually shut down all the cities. The coronavirus was starting to spread really bad, so they shut all the businesses down. The only thing was open, the banks and the grocery stores. They had no traffic on the road. Shenzhen, I left Shenzhen early December. The roads are packed with people. Now there's no one. I've got friends there. They'll show me the camera while they're walking to get food, go straight back to their house. They've been in since January 15th. China's planning on opening up April 9th to go back to work. So they've been sitting in their house all that time, every one of my friends, seriously, and they have not gone out, but I talk to them quite frequently. And that's why they only had 83,000 breakout.
Well,
here we're going to have millions.
Yeah. Thank you for that, Mr. Abernathy. And we probably need to run out of time. Jason, back to you.
Okay. We're going to take our next caller, and that's Alan Brewer from Silsbee. Alan, are you on?
Yes, sir.
Go ahead, sir.
Congressman, it's a two-part question. My first question is, with this relief package, why is it that every time there's a national crisis, our first instinct is to bail out all these airlines? We give money to these people all the time, and it's a government-ran program with TSA. It's a massive government-ran program. So why would we bail out these multi-billion-dollar airlines instead of giving money to small business owners? My second question is, how long before Silsbee and surrounding areas gets what the president had promised, these quick response tests?
All right. Thank you for those questions, Alan. I'm going to take them in reverse, actually. I wish I could give you an exact time, as we talked to the lady earlier from Galveston County about getting all the tests rolling out. Again, as the doctors have mentioned, they are producing those as quickly as possible. Of course, you heard Assistant Chief Sean Miller from Texas Department of Emergency Management talk about the website where people can go on and they can become a vendor. They can say, look, we've got, whether it's equipment, whether it's tests, whether it's services, they can, even if they're a retired doctor, they can apply and to help. So I think you're seeing that getting revved up as quickly as possible. And that's not just in Silsbee, of course, that's Beaumont, Jefferson, that's going to be across Galveston and on into Missouri County. And, of course, we're concerned about all of Texas, obviously, and all of the country for that matter. But I think you're going to see those revving up as quickly as possible. And quite frankly, the more town halls we have, the more conference calls we have where people are sharing their successes and what's working, I think the quicker it's going to work. If you were on earlier, you heard me say Texas is resilient. We'll bounce back probably quicker than any of the other lesser 49 states. But anyway, so that's number one. Number two, your first question was, why do the airlines get bailed out for small businesses? I wasn't there for the first airline bailout way back in the day. I was here on this one. And I think you will be pleasantly surprised that a lot of the big businesses that need loans at a very, very low interest rate to be able to keep going, that produce the economy's transportation infrastructure business, you're going to see, but you're going to see small businesses. $350 billion was appropriated to small businesses. And me being a former small business owner, 35 years, owned my own air conditioning company, if I remember the stats right, 70% of Americans work for small businesses. Congress is very, very keenly aware of that. So there's a lot of money going out. You're seeing the date for income tax filing being rolled back. You're going to see some loan forgiveness. You're seeing, student debt on federal loans, interest being held up or discounted, I should say. But I think you're going to be pleasantly surprised in this instance that we've got a better plan than one they might have had years gone by. They're supposed to roll it out tomorrow. Again, rules are being promulgated. We've got a specialist here, a public information officer from the Small Business Administration, part of the government. And so I think you're going to find out, pleasantly surprised, that there's a big focus on business, on workers, on employees. I don't know if you heard the comments earlier. Even those who are self-employed, even those who are subcontractors or contractors can apply. So stay tuned, because I think you're going to be pleasantly surprised there. Thank you for that question. Jason, I'm going to kick it back to you.
Okay, great. Thank you. And I'd like to remind everyone, we're getting short on time here, so if you wouldn't mind when you ask your question, if you would mind, ask it quickly. We're going to try to answer it quickly so we can get to as many of these as possible. We're going to go to Jackie Dupuy, who's over in Jefferson County. Go ahead, Jackie.
Hi. Yes, my question is somewhat similar to the questions previously about the testing and the test kits. We have a large number of people here who have had symptoms, who have complained, who are not able to get tested. Sometimes they're sent home. They call into the hotline. They're told that their criteria doesn't meet it, even though they do have fever. Some of these people are finding now that they're very sick, and we've been waiting for tests. It was talked about going on a month now that there were plenty of tests, beautiful tests. Everyone who wants to be tested may be tested. All of this rhetoric we have heard over and over. And where are the test kits? And why is Texas so far behind on testing? Other states are starting to ramp up, and we see them now. But again, behind the eight ball. We are really behind the eight ball, and people are dying. I want to know, where are our test kits, and why wouldn't we want to test anyone and everyone who feels like they need a test? Because the more you know, the more power we have, and then we know our percentages of what part of the population is asymptomatic yet spreading this virus.
Well, thank you for that question, Jackie, and I'm going to kick it over to Dr. Waltz in just a minute. But I think part of the answer is they're trying to meet out these tests to those who have the most symptoms, because we do have a limited number of tests. And the category of people that are the most vulnerable or at risk are some of our senior population. I know there's younger and middle-aged and all right on up, but I think the largest percentage is in that upper, I forget, is it 60 and above or 65 and above? I forget what it is. So I think they're having to meter those out as much as they can. Dr. Waltz can probably speak to where the test kits are in Jefferson County now before he gets there. I think, why is Texas behind? I think you would, Assistant Chief Miller would agree with us from Texas Department of Emergency Management. They're doing everything they can, Miss Jackie. And again, I've been on, I can't tell you how many conference calls with the state, with Harris County, with Congress, with the White House, with even FDA. We've had conference calls. Everybody is doing absolutely as much as they can. I know it's frustrating and it's scary too, quite frankly. Scary because you think, I have a friend or I have a family member that looks like he or she has those symptoms, and they're calling in and they're doing a little questioning over the phone to see if they want to come in. So I know it's frustrating. I know it's scary. But so I think you're going to see Texas catch up pretty rapidly. Even tonight, a guy called in and said he's got access to 30,000 masks a month. I'm hoping that's the same thing with test kits. They're rolling them off as quick as they can. Dr. Waltz, maybe you can answer a question about where the test kits are available.
Well, we've been trying to get test kits all over the country. We now get their test kits from a biotech lab in New Jersey, and they have about a 48-hour turnaround for tests when they've been done. In the call center, they're using the CDC protocol for testing. And what is happening is we're testing those persons who are most likely to have the disease. And so far, we've tested about 550 persons, and of those, all of them had symptoms, but only 15% of them were positive. We're not saying that that is the right number to be testing at this stage. We should be testing more, but we only can receive about 200 tests a day or so, and that's the problem. The problem is that there are not enough test kits available.
Well, thank you for that, Doctor. And listen, we've got Commissioner Gruber on the line with the Texas Department of State Health. Commissioner, what insight could you give us?
I think there was initial concern that there were not enough test kits, and that was a valid concern. As of today, we've performed as a state, and this is a combination of the public health and commercial laboratories, over 50,000 tests, over 50,600 tests as of today. So right now with the commercial laboratories gearing up, testing is becoming more and more available, but I agree with everyone, Congressman, you and both Dr. Walls, who I have a tremendous respect for, that, initially when there were, and even now when the tests are not as available as we'd like them to be, we do have to focus on those that most need it, and in those that, if we identify, can prevent the spread to others.
Well, so this is Assistant Chief Miller with TDM, and I just want to say that Texas actually is leading the country in testing, screening, and the number of community-based testing sites. We were provided a report by the federal government today, and actually Texas has more community-based testing sites than even New York at the moment. And we are testing more people each day than even New York, which is the current hotspot of the country. We definitely want more test kits to come into the state so we could test more people. But I do want to make sure everyone knows that Texas leads across all the states.
Well, thank you for that. That's good to hear. Again, I want everybody to be encouraged because we are working fast and furiously. As I said about Texas earlier, even with Ike or with all the hurricanes or with Ebola, our great University of Texas Medical Branch of Galveston, Rick Perry, made sure that they were the repository if you were any patients with Ebola. That's how much expertise we've got here in Texas. So I appreciate your input on that, Commissioner. Jason, back to you.
Great, I appreciate that. We're going to try to get to as many questions as we can, but one thing I did want to remind everyone is if you had an opportunity to ask a question to one of our screeners and you didn't have an opportunity to ask it of the congressman and our guests, your questions have been transcribed from our screeners, and we have that on file, and the congressman's office is going to be able to follow up with that or make sure that your question gets to the appropriate person. So I just want to let everyone know we are running short on time, and if we miss you, if you did ask a question of our screener, that doesn't mean that you won't get to have that question answered. We will make sure that we get it to the appropriate person. With that, we're going to go on to our next call. We're going to try to get to a few more here. Mr. Mark DeLasso in Galveston. Mark, you on?
Yes, I'm here. I'm here. I just want to say, first off, happy birthday to my daughter Zoe, and my question is specifically referring to the PPP and the loan forgiveness. There is some verbiage that says that if you have a reduction in workforce from last year to this year, that the loan forgiveness amount will be reduced. And my question is, there's some confusion on whether that reduction in workforce is based on only full-time employees or if it also includes part-time employees. Go ahead.
Thank you, Mark, for that question. Mr. Kumar, I'm going to toss that one over into your lap, please, sir.
I don't have any visibility specifically because our talking points have been quite sparse. So perhaps I could respond to you, sir, tomorrow once I get more talking points to your office, and we can forward on to the gentleman, because I wouldn't want to speculate, thereby misleading not only the callers on the line, but also the gentleman who asked the question. Is that all right?
Yeah, thank you for that, Mark. Let me just jump in here real quick and say thank you for that question, because these are the kinds of questions we're getting. And as we've been on these conference calls and getting these wrong answers, we have to understand that the president has done everything he can to push as quickly as he can. Mnuchin with the Treasury has been working on it. You're seeing, as we mentioned earlier, Dr. Fauci working on it. You're seeing people on the Financial Services Committee in Congress working fast and furious on this, trying to do everything they can to make sure that there's no misunderstandings, and that as many people that need to qualify will qualify, and that we'll keep as much of this country business from going down under, if you will, so that we can get right back onto a record economy as soon as we can come out of this. So I appreciate Mr. Kumar being willing to visit with you on that, and we know that the Congress and all the agencies that are affected by this are doing everything they can humanly possible to get this out as quickly as possible. So thanks for staying tuned, and thank you for that question. Jason?
And Congressman, I just wanted to add to that, we do have Mr. Belosso's information, and we forwarded that on to your office, so they'll be able to make sure that we get that information over to Mr. Kumar and can follow up. So
yep.
Thank you for that.
Did you notice that he didn't say how old Zoe was?
You know, it's not polite to ask that. All right, we're going to move on to our next caller, and this is a gentleman by the name of Alfred Burns, who's calling from Alvin, Texas. Alfred, go ahead.
Yes, thank you for having me, Congressman Weber, an honored guest. I appreciate the opportunity. Most of my questions have been answered already by y'all. You've done a very good job. Thank you for your hard work and endless hours. I know you haven't had much sleep. But I did want to extend an offer, which I can do through texas.gov, I understand. I'm a experienced, highly trained former EMT, former firefighter with extensive mass trauma experience.
Well, that's
so
good to hear, Mr. Burns. How long have you lived in Alvin?
I have lived in Alvin since 2014.
Okay.
So I've not been here long, but I was in the bleeding heart of Texas for over 25 years. That'll be Lampasas.
No, I've been up to Lampasas. Well, we always
great place.
Oh, you betcha. We appreciate our first responders, so thank you for that. And yeah, if you don't mind, go on that website, and we can sure use the help. Trust me, and we appreciate that offer. Jason?
Okay, thank you. We're going to get to just a few more here. We're going to go to Dave Stewart in Texas City. David, are you on?
Yeah, I'm here.
Go ahead, sir.
Yes, sir. You brought up you told me that the numbers, and I've heard those numbers thrown out before, or somebody else answered that, about 50,000 Texans being tested out of 28.7 million. And that's just mind-boggling to me, because of the fact that we are looking at, the question I had before was about how many people have been tested in Galveston County, but we've only tested, 0.2 of the percent of the Texans. And how can we know how many people are actually infected? And why aren't these tests available? Why have so many other countries produced, have done their testing and tested large percentages of their population, and we're so far behind everybody else? That's just mind-boggling to me.
Well, thank you for the question, Mr. Stewart. I don't know the exact percentages of whether it's China and Italy and some of the other countries, for example, Iran and some of the other ones. I will say this about China. I was traveling with my daughter today doing some very necessary business as the requirements are. And she was reading online that China pretty much shut down all their population by having phone apps where you were only approved to go outside if you had the right app and you had the right number or designation. So I think they absolutely, shut down almost all activity. I think you heard it earlier said that only the banks and the grocery stores were open. And so, the governors here in this country have been reluctant to do that, to go that drastic. And so they've taken those steps, very thoughtful, very deliberate, and some would say timely, some might say not fast enough, some might say too quick. But to compare us to those countries, I don't know the exact percentages, but I will say, I've been on these town halls with all these different calls, all these conference calls, rather, and I know that they're working as fast as they can. I've listened to governors who I know, I've listened to, the scientists and doctors who I know, and a lot of these agencies, like we've got some great public employees, workers on today, public servants on the call this day, and they're working as fast and furious as they can. And I know it's frustrating, and I know it doesn't seem to make sense, but I can tell you this, we're seeing people get kicked into high gear like never before. And even though this has been, 3 months, January 15th, February, March, April 15th, not quite, you're really going to see things turn around, and we're working hard to do that. So I want you to be encouraged and to reassure you, your government, and that's county, state, federal, is all over this. And we're going to get there. So I appreciate that question. Jason?
Okay, we're going to go ahead, and our next caller is either Susan or Charles DeBois from League City. I'm not sure who's on the line. We've got two names here. Go ahead with your question.
This is Susan.
Okay.
I grabbed the husband's phone. Yeah. Shout out to the Golden Triangle too. That's where I'm originally from. But anyway, I'm concerned about the elderly, the seniors. My mom's in an assisted living facility, the Delaney, and of course they're on lockdown. I can't go see her. I don't have a way to I had a sitter with her. Her sitter can't go because it's not medically necessary, but it was kind of mentally necessary. You know what I mean? Yep. So, she had company, she had someone to talk to. Now she's pretty much locked in her little room. So they're very good. I'm not saying anything bad about that facility. I'm just saying I have a lot of customers because my customer base is 65 and older. I sell Medicare supplemental insurance. Understand that very clearly. I have a lot of customers who have elderly people living in their homes. The problem is getting supplies. For the elderly like that, sometimes there's not any, and if it's a person you can't take somewhere who can't move themselves, I think it's a huge problem. I think this is a giant problem that no one's really talking about. And what I want to know is there any resources? Is there any way for these people who can't, I can't take my mom to get the screws out of her ankle from her broken ankle because it's not considered a necessary operation. So now she can't do her physical therapy as well because she doesn't have the mobility in that ankle as well. And things like that. So there's just so many issues. I just wondered, did anybody stockpile PPE supplies for the elderly in our community or for caregivers in our community who need help with that? Or do you have any, and I have to buy supplies for my mom and I have to bring them up to the Delaney, and I can't go in the facility, and then they spray it down. They're really good about, and I don't want her to get infected, but I just think that's a multi-point issue that needs to be addressed in some way, or some information needs to get out to everybody about, what can all these caregiver people I know do.
Well, thank you for that, Susan. Glad to hear you from the Golden Triangle. I have to say that because I know you've watched this. My goodness, I've lived in a 20-mile radius 66 years. I've never seen anything like this coronavirus or COVID-19, whatever you choose to label it. And there's been a lot of people going to the stores and buying up everything they can. And so I know there's a lot of shortages everywhere. And I know the supply chains. And again, I've been on conference calls with some of these companies and stuff where they haven't been able to keep up. And they're trying to get their people out, and they've got people that, maybe aren't coming to work because they don't want to be around the potential virus, and they're trying to get their supply chains built back up. And of course, you're trying to get people to go into these some of these facilities, whether it's medical facility or assisted living or other facility, and trying to bring in as much as they can. And just I feel your pain, because my mother is 90 years old, and I've not been able to even go see her for 2 weeks because I've been around, people on an airplane, for example. We flew back from Washington, D.C. to Friendswood, and couldn't even go see my own mother because I had to make sure that I was, basically self-quarantined for 14 days. And I think you're seeing the results of a lot of that. Our supply chains really weren't set up to produce the kind of stuff this quickly, but they've kicked into high gear. Thank you, President Trump, for invoking the act that let them do that. And thank you to these businesses. You'll read about a lot of them that have agreed to change their manufacturing facility into producing these kinds of things. Now, you're right. We need to get them to the county, down to the county level. Let me jump over, if I can, maybe to Dr. Kaiser, if he knows of anything that might be something similar like that. Doctor?
Sure. We're monitoring the situation in nursing homes very, very carefully. We are actually going to be issuing some public health orders to all nursing homes that they have to follow the CDC guidelines. It sounds like where your mother are, they're doing that, and so we can keep COVID out of the nursing homes. We're also compiling a list of services available for seniors that we have had a group of volunteers working on for the last several weeks to try and figure out all the potential services that might be available, and we should have that up on our website within the next day or two.
And let me thank you for that. Let me go back to Commissioner Gruber. Commissioner, what are y'all seeing across the state?
Yeah, I think it's a valid concern. One of our top priorities, one of our top three priorities is vulnerable populations and the elderly. Those who are in assisted living and long-term care facilities are of significant concern to us, particularly when you saw what happened out in Washington. So we've actually convened a work group, and tomorrow we will have a call with all of the long-term care facilities along with Health and Human Service Commission as we provide them some assistance in how to respond to any event that might occur, giving specific steps and specific things that we would be able to help them with. But I think that we should all be looking at how we can assist that population, because it really is people that we care about and are most susceptible.
Well, thank you, Commissioner. I appreciate that. And let me just say, we are working fast and furious. I so appreciate you guys being on the call with us. Jason, what do you got?
Well, unfortunately, Congressman, we have reached our time limit, and we are, if you like, I'd mentioned to some of the folks on the call, if you had an opportunity to ask a question of our screeners but didn't get a chance to ask it of the Congressman and the rest of our team, we are going to do everything we can to make sure that your question gets answered. But we appreciate everyone jumping on this call. Congressman, I'm going to let you have the floor to take us out here. And again, thanks to our panel for jumping on. And Congressman, the floor is yours.
Well, thank you, Jason. And I do want to say thank you to our panel. My goodness, we appreciate y'all taking your time out. I know y'all are absolutely swamped. This is not the only congressional district that you've been helping to take care of. So, Dr. Walks, thank you for being on. Dr. Kaiser, Mr. Kumar, Commissioner Gruber. I know that Chief Blair Walsh wanted to be with us, and she couldn't be. And bless her heart, we're going to keep her in our thoughts and prayers that she gets to feeling better. And Assistant Chief Sean Miller, thank you. And I want to say thank you, Jason and team, all of our screeners and everybody that was on this. And I do want to repeat before we close that y'all can find me on my website, weber.house.gov. And please do that. Sign up for our e-newsletter. As our town hall comes to an end, I want to say thank you to all who have called in. Thank you for all the input, all the questions. Let me just tell you, I appreciate y'all. I work for y'all. I appreciate y'all taking the time out to participate. Again, if you were not able to ask a question or share your comment, visit our website, maybe get it on there for us. Again, we are working. We're not necessarily in the offices in case you stop by, but we're working from home. We have computers, and we're doing everything we can to keep up. It is an absolute delight to be able to represent you all. Me and my bride appreciate that. Appreciate the trust you've put into us. And again, thank you for being on the call with us. And I want to say to everybody, please be safe. Thank you for being here. We're counting on you. And good night to everyone.
Thank you, Congressman.
This concludes our teleforum. Thank you so much. Goodbye.